I'm Dr. Kevin Casey. We're doing a series on men's health, and today I have Dr. Mark Belfer here to help talk about preventive health. Mark, welcome.
Well, thank you for inviting me, Kevin. You know, men's health is obviously very important to you, to me, to every man. Interestingly, you know, the person that makes the appointment for male patients is usually a woman.
Yeah, frequently hear that. Let's talk about what we're going to have to eat. And so we have a meal of salmon, asparagus, peppers, and mushrooms provided by our nutritionist. It's a wonderful, tasty dish and a great nutritious dish as well. So Mark, let's talk a little bit about colorectal cancer screening. I see patients for colonoscopies as a large part of what I do. I reinforce the importance of colonoscopy. Colonoscopy as a screening test is done with sedation. Procedure generally takes about 15 to 20 minutes. Patients are given a medication that makes them relax. They go to sleep for the procedure, they wake up often, and the most common response I get afterwards is, when are you going to start the procedure?
You know, you bring up a good point with colonoscopy because you know me better than most, because you did my colonoscopy about 2 years ago, and thank goodness it was normal. There are other tests, though, that can be done. And another test is called the FIT test, or the fecal immunochemical test. The fecal immunochemical test, as you know, is done annually. It's done on stool, and actually the statistics are great on it for helping to prevent morbidity and mortality from colorectal cancer. Now the American Cancer Society is recommending starting screening at age 45, and there have been more patients diagnosed earlier than age 50 with colorectal cancer, and you know, nobody should get colorectal cancer because it's actually very preventable. In fact, any screening, the estimate is if you do 1,000 screenings, it may prevent 22 to 24 deaths. That's a huge number.
And as a preventative test, it's actually more cost effective than seat belts in your car.
Yes.
It saves more lives.
It does, it saves more lives.
Mark, I want to thank you for coming to the first of the Cooking with Casey series on men's health. Would emphasize that it's very important for men to see their primary care physician because they're the ones who can initiate the preventive measures that they need to do, as well as pay attention to the health issues that they have. So thank you very much for coming.
Thank you, Kevin. Cheers.
Cheers. We'll be doing more of these episodes, so look for these episodes of Cooking with Casey as we talk about other issues important to men's health.